and the bangle. I hope you've enjoyed this tutorial. The month of July is plastic free, so I am encouraging you to reduce the use of single-use plastic.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning, standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart, and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Everybody beware, and you better prepare. Disaster can happen anytime, anywhere.
International news sources such as CNN, BBC, or the Weather Channel
diabetes, kidney disease, or a respiratory condition. It is advisable to avoid large crowds or other places where you might have to come in contact with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
Hi everyone, good day. My name is Vincia Collins from Vincia's Artistry. Today I will be making a pair of earrings from plastic. So let's just get right into it. This is the pattern. It actually was cut from Clorox bottle. I will be painting it with polish, used polish, and I will be doing a tie-dye sort of effect. It's my own unique way of painting on plastic. Be sure to use your gloves when you're dealing with polish, but you can always use acetone or polish remover to get the stains off your finger. We're going to give this a few minutes or two to dry, and then we will do the other side. Let's turn on the other side, and we're going to do the same just as we do the front side. Look at that. Isn't that unique? After this has dried, we will then enter the air wire. Our earrings has fully dried, so we're now going to put in the air wire. So we're going to use the tip-in, and we're just going to paste the earrings. Put both of them together, preferably. And we're just going to paste right through. Okay, we're going to put in the rings. And we're going to put in the air wire.
Is on.
A pleasant afternoon. Thank you very much for joining us for the National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 21st of October, 2020. We continue to update you on what is happening in the Federation of St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. Of course, the management of the COVID-19 pandemic is extremely important if we are to safeguard our public health and safety. Today I would invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast by whatever means. The state of emergency was recently extended by a resolution of Parliament until December 31st, 2020. New regulations have also been published and expires December 31st, 2020. These new regulations are just an extension of the last set of regulations. All the provisions remain the same. However, a new COVID-19 prevention and mitigation bill had its first reading in Parliament. This bill is intended to replace the emergency powers COVID-19 regulations and provide a more permanent legal framework to regulate the containment of spread of COVID-19 in the Federation. The main provisions of the COVID-19 regulations, which we are all quite familiar with, will form part of this new bill. It will also give legal effect to all the protocols that will be implemented at our air and seaports for incoming travelers and at our hotels and other tourism-related sites. There will be a strict regime of COVID-19 inspections and certification for all major sectors of our economy. Our hotels, taxi and tour operators, sea transportation and boating sector, tourism-related sites, and educational institutions. All sectors will be required to satisfactorily show that they can safely operate in a manner that significantly minimizes risk to public health. A critical and important component to our efforts to prevent spread will be compliance. Therefore, the law makes provision for a compliance team and has given this team broad authority to enter businesses, enterprises, and offices to ensure compliance with the provisions of the law. The compliance team is also empowered to monitor all social events to ensure that these events have the necessary approvals from the Commissioner of Police and are complying with the terms and conditions of such approval. There is also some protection for the compliance team. The law provides a person who obstructs any member of the National COVID Task Force or a member of the compliance team commits an offense and is liable on summary conviction to a fine not exceeding $5,000. As we prepare for the reopening of our borders in the next 10 days, we hope that our citizens and residents appreciate what we are doing and adopt the non-pharmaceutical interventions as a new way of life, as they are the only way at this time to safely coexist with the virus. Wear your masks, practice good hygiene and sanitization habits, and observe social and physical distance protocols. And these should hopefully keep you safe. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital, to give us the Health Emergency Operations Center Situation Report. Dr. Wilkinson.
Thank you very much, Lesoy. And just by way of information, the Chief Medical Officer could not make it today, so I am filling in for her. Can we get the presentation? Now, St. Kitts and Nevis, we are still in the middle of pandemic, COVID-19, and to date we've had 19 positive cases in the Federation, 13 in St. Kitts, and 6 in Nevis. When we look at the CAFA region, we see that the virus is still very much with us. There have been over 250,000 confirmed cases, with 151,623 recoveries and 4,296 deaths. Closer, when we look at the CAFA member state, the 24 countries that we're in, we have 47,000 cases, over 34,000 recoveries, and 972 deaths. Thanks to God, so far, St. Kitts and Nevis have not contributed to the death toll that we see within the CAFA region. When we look north towards the United States, we see that they're still struggling to contain the pandemic, and as of today, they have over 8 million confirmed cases and 221,460 deaths. And the states that you see in red are states that are seeing an increase in the number of positive cases. Globally, we are still fighting to contain the pandemic with over 40 million positive cases globally, and are seeing a significant increase in positive cases in one day. That is 350,424 cases. We should not be disheartened, however, because whereas earlier in the pandemic, globally and regionally, we were only testing persons who were symptomatic. Now, with the readily availability of a number of tests, we are testing more persons, and so we expect to see the number of positive cases increase. However, the deaths are still pretty high, 1.1 million globally. In St. Kitts and Nevis, we continue to do our testing, and to date, we've tested over 2,906 persons, and our positivity rate is 0.7, which is very low. Countries should aim to have a positivity rate of below 5%, and so we are doing a great job, the fact that our positivity rate is less than 1%. We also continue to repatriate our nationals and students, and to date, we have returned 505 persons to the Federation of St. Kitts and Nevis. And of the positive cases, we know that they have all been recovered. About 2 weeks ago, the Chief Medical Officer mentioned that we repatriated 155 Ross students, 135 out of Miami, and 20 from San Juan, Puerto Rico. I'm happy to say that today they were all tested, and all of them came back negative, and so as we speak, those 155 students have been released from quarantine, and they're now free to move about freely in the Federation. And so don't be surprised if you see them out in the supermarket, on the strip, or in any entertainment centers. These are not persons who are breaking quarantine. They went to their 14-day mandatory quarantine, were tested when they came in, tested again at 14 days, and tested negative, and so they're now being released. Move on. As countries continue to open their borders, we are seeing an increase in the number of positive cases. For example, Barbados has 14 new cases, Antigua 8, and St. Lucia 7 new cases. And we should expect no difference when we open our borders, because once the borders are open, we would expect to see an increase in the positive cases. Next slide. The most important thing, however, is for us to be able to identify every case, contain the case, test persons who need to be tested to make sure that the virus doesn't hitch a ride from one person to the other, and then we end up with community spread. And so on the 31st of December, on the 31st of October, next slide, when we open, we encourage you to remain vigilant, and we can't overemphasize the non-pharmaceutical measures that we keep repeating here that you need to do. And the graphics show it quite clear there. You need to continue with your physical distancing, stay more than 6 feet from someone, continue with the hand hygiene, and you need to wear your mask. And there are a number of persons who are wearing the mask, but they wear the mask below their chin, below the nose, in their pockets. And so when we say wear a mask, we mean that you need to cover your nose, cover your mouth, so that you reduce the spread of the respiratory droplets. And you need to avoid crowded places, and crowded places just doesn't refer to parks and stadiums and fetes. You can have a crowded church, you can have crowded schools, etc. And so we need to make sure that we adopt all of these non-pharmaceutical measures in every aspect of our life. The mask, go back, the mask can become a fashion statement. And so whereas early on we were encouraging persons to wear the surgical mask, there are a number of masks that are being made to the proper specification with the 3 layers that can contain the spread of the virus. And so it is thought now that wearing the mask not only protects the person who you are coming in contact with, but it also protects you. And so you can make it a fashion statement and have a mask for every day of the week to go with your color shirt or your color dress. And so we need to see more of this. In addition to COVID-19, we have to remember that life goes on, and we still have to continue to fight other diseases. And one that we are acutely aware of is dengue. And most persons will not be aware that we are in the dengue season. We haven't had any cases here since our borders have been closed, and the mosquitoes need a plane ride from south to come up here. And so we have not had any dengue cases. However, when the borders are open, we may have the virus coming up here with one of these mosquitoes who inadvertently might get on an airplane. And so it's important for you to remember the simple things that you can do to protect yourself from dengue. Wearing protective clothing, and we need to spell out what that is. It means that you have to wear a long sleeve shirt or long sleeve pants, especially with children, because sometimes persons will bring a child to see the doctor, and the child has a number of septic spots on the arms and the legs, and they're thinking it's some allergy. But when you remove the rest of the clothes, you realize that there are no spots on the chest or on the buttocks, which is normally covered by the clothes. And when you explain to them that it's the areas that were exposed that are being bitten by the mosquito, and that is why the child is getting the infections, they're actually surprised. And so when we say wear protective clothing, we mean clothes that's going to cover most of your skin surface so that the mosquito has less of an opportunity to bite you. I know that the mosquitoes appear to be getting pretty smart. They're even biting people through their clothes now, so you may need to wear an undershirt, etc., to protect yourself. And if you can't, you need to put mosquito repellent on, and make sure that if you have a house that is screened, it's properly screened. I know most persons may not have air condition, but there are certain things that you can do, even buying a mosquito net to put over your bed when you go to sleep to make sure that these mosquitoes don't get to you. And the mosquitoes, they can multiply where we have stagnant water. You need to make sure that there are no empty containers around where the mosquitoes can multiply. Even your toilet, you need to make sure that the toilet seat is closed so the mosquitoes don't go in there and multiply. I believe that that is the end of the presentation. Thank you very much for listening.
Thank you very much, Dr. Wilkinson, for filling in for Dr. Laws and doing such a wonderful job. We now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force and the National Disaster Coordinator, to bring us his presentation.
Thank you, Mr. Williams, and good afternoon to all. Thank you for joining us again this week. Again, we continue our preparedness measures as it regards to the reopening of our borders and managing our local situation here in St. Kitts and Nevis as it regards to the coronavirus or the present pandemic that we are facing. Today I want to focus on how do we avoid another COVID-19 lockdown. These lockdowns, based on an article that was shared by the Business Insider, shows that lockdowns have a socioeconomic impact on our societies. We have seen economies around the world actually being impacted. We have seen also the psychological impact that these lockdowns have had on children, teenagers, and also adults. Here in St. Kitts and Nevis, it has been our motto to attempt to avoid a second lockdown. We already experienced the long lines, the panic shopping. We continue to experience some of the restrictions on our social activities. And also, we have seen the great economic impact it has had on our labor force and also our economy. One of the areas that I want to focus on today is governance. Now, governance has 3 tiers, and I want to go through this discussion with you real quickly. I want to take a look at the executive level, the community, the technical and business sector, and also the community. Let's first look at the executive level. In the executive level, we want to look at the government, in particular the cabinet level. The cabinet level, being advised by the technical team, has to exercise prudence. Prudence in giving us the necessary legal framework, as explained by Superintendent Henry, the necessary legal framework to be able to do our job, and that is very critical. It also requires the necessary funding or financing of activities that will help us in executing our necessary operations. We also looked at the necessary stimulus packages that would have been used here in St. Kitts and Nevis for our citizens and residents who would have lost their job. And speaking about that, we have seen that a number of our citizens, in particular the tourism sector, have lost their job, and we are doing our best right now to implement the necessary policies to build resilience in the tourism industry. As Dr. Wilkinson would have said, and what we have been experiencing throughout the region and also in consultation with our regional partners is that once the borders are opening, the realistic thing is that we will get cases. However, what we do when these cases come into the country, what will determine our way forward. So having the legal framework, having the necessary finances, and having intervention programs to support those who may be impacted or affected by the virus is critical for the executive level to prioritize. Secondly, let's take a look at the technical teams and the business sector. When we talk about the technical teams, you're talking about the National COVID-19 Task Force, you're talking about the technical persons that are doing the necessaries to ensure that we A, have a preparedness plan, 2, that we have a recovery plan, and 3, that there's a level of resilience in the country. The business sector requires strong support from the public sector technical teams, such as the COVID-19 Task Force. The business sector also is required to support the legal framework that is implemented. For example, the compliance of hand hygiene, the cleaning schedules for sanitizations. You're also looking at the wearing of face masks, the markings, the necessary marking for social and physical distancing. And that is very crucial. Every day we see the compliance team goes out, and as they go out, every day they return with reports of the lack of compliance by a number of business places by simply not putting markings to separate persons, not even having sneeze guards, cough guards to protect the staff, and also to protect customers. We're also looking at not having hand sanitization stations, or even having a spray bottle to help with the hand hygiene. These are basic things that the business sector can do to support the efforts in St. Kitts and Nevis against the coronavirus. We also need to look at the community level. The community level is important, and what we need to do at the community level is to have educational programs, have the necessary persons in the community advocate for cultural change. And that is very critical in the fight against COVID-19. We need to have that cultural change. If we don't have that change, then we are going to be challenged going forward. So these are 3 critical levels that we have to look at going forward in terms of having good governance. It's an all-of-society approach, and everybody has to play a part. Now, I want to commend the Compliance Task Force in our next slide. Compliance Task Force for the job that they have been doing over the weekend. Event organizers given prior approval failed to comply with the stipulated protocols, and therefore, with the support of the Royal St. Christopher and Nevis Police Force, the event was shut down. Again, let this be a warning to all. We are moving forward in opening our borders. We are doing everything to begin to normalize a way of life again in St. Kitts and Nevis. However, cooperation is needed. The compliance team visited this event on several occasions. They gave the necessary caution. They advised what is needed. However, the host of the event decided that to violate the terms and conditions given to him or her, and hence the necessary actions were taken in the interest of public health and safety. So therefore, I am appealing to all event organizers who continue to break the terms and conditions to host the events. You will be dealt with accordingly during these times. We need everybody on board. We need your support. And if you continue to break the law, you will be dealt with accordingly. We continue to monitor the activities in the Atlantic. The Atlantic for now seems very silent. So therefore, we are very thankful, and we ask you to continue to pray for the nation. We see that there is a hurricane in the Atlantic, which is basically a fish storm, and we're hopeful that it will not impact any land mass. The synopsis for the weather, the local weather in St. Kitts and Nevis, is that it should be partly sunny. For the day, we should be experiencing a 20% chance of showers. Sunrise tomorrow morning will be at 6:05 a.m. And sunset will be at 5:45 p.m. So thank you very much for listening. And again, we do look forward for your questions, and we will attempt to provide the necessary answers.
Thank you very much, Mr. Samuel, of course, fulfilling both of your roles, that of the National Disaster Coordinator and Chair of the COVID-19 National Task Force. We now have our question and answer segment, and I would start the ball off by asking Dr. Wilkinson. Dr. Wilkinson, what is COVID fatigue? I have been hearing about this recently. Is it a real problem?
Thank you very much, Leslie. Yes, COVID fatigue is real and it is strong. And basically, persons are getting tired of being locked up. They're tired of having to be quarantined. They're tired of wearing a mask. They're tired of socially distancing. They're tired of the fact that they can't go out and party as they used to. As it pertains to here in St. Kitts, people are tired of the fact that we're at the end of October, going into November, which is supposed to be our Christmas and Carnival season, and they're not seeing the norms as they were. And this is actually a normal reaction to any chronic stressful event. If we look back a few months when we first started with this pandemic, we had almost everybody on board. And as the pandemic went on and the stresses associated with it became more apparent, people's patience wore thin. And so they start to let their guards down and become complacent. And this actually, this COVID fatigue is what is contributing to some of the spikes that we are seeing in some of the nations around the world, because people are tired now of trying to adopt the new norm. They have stopped listening to their healthcare providers and the scientists as to what needs to be done. But we need to tell persons that the virus hasn't given up, it hasn't gone away. And so despite the fact that this is a normal reaction to chronic stress, you still need to stay focused and vigilant and continue with the non-pharmaceutical measures that we spoke about. This, however, is to be distinguished from chronic fatigue associated with recovering from COVID-19. There are some persons who get COVID-19 and when they recover, they continue to have chronic aches and pains and body aches. So there are two different things. COVID fatigue, which means people are just getting tired of the restrictions that are being placed upon them, and fatigue associated with COVID-19 disease.
Question number 2. The Prime Minister stated recently that the Federation signed an agreement with the Global Alliance for Vaccines and Immunizations. Monies were paid to ensure that we have access to the COVID vaccine when it becomes available. We have also heard of some vaccine trials being put on hold because of serious side effects. We also see the politicization of the vaccine in the USA, with a rush to have one out before the US elections. What assurances do we have that we will be given a safe vaccine and not be used as part of an extended vaccine trial? Dr. Wilkinson.
Thank you. That's why Gavi, or the Global Alliance for Vaccine and Immunization that you mentioned, that the Prime Minister said that we signed on to, is a public-private association whose aim really is to globally procure vaccines and make sure that they're readily available to the poorest countries around the world. And this is an organization that has been around for more than 20 years, and they are responsible for getting vaccines to more than half of the world's children. And so although you might be hearing about it now, they're very active in procuring vaccines like diphtheria and pertussis or whooping cough. And so this is not something that has just recently come up. And basically, the aim is to make sure that when the vaccine becomes available, it's available and accessible to every single person around the world, and not just to the first world countries who have the financial resources to pay for the vaccine. And so we have philanthropic persons like Bill Gates, etc., who are actually on board, and other private organizations, to make sure that the cost of the vaccine can come down and it can be readily available. And this will only be put out to the rest of the world once all of the trials are done. And so there should be no fear of us getting a vaccine that is not properly tested and tried. And so this would be a safe way and an efficient way for us, along with the rest of the world, to get a vaccine once it is ready to come to be placed in the general population.
The third question: with the winter approaching in North America and Europe, we are beginning to see them experiencing an increase in their number of cases of COVID-19. Some call it their second wave. This, unfortunately, is happening as we are about to open our borders to them. Are there any concerns about the reintroduction of the virus into the Federation? And can you assure us that with the measures you have put in place, that we will be safe? Dr. Wilkinson again.
Well, I think we've said for months that we cannot keep the country locked down forever, and we said that once the borders are opened, there is a chance that the virus would return to the Federation inevitably. And so, yes, we are planning to open the borders on the 31st of this month. And yes, just like every other country that has opened, they have seen the reintroduction of the virus, and we will try to see whether all of the measures that we've put in place will help us to contain the virus. But one should not be worried about whether or not the virus comes back in here. The most important thing is making sure that we do what is necessary to contain the virus, because the virus is always looking to hitch a ride from one person to the other. And so once you continue doing all of the non-pharmaceutical measures, which I would not repeat again, to contain the virus, we should be fine. And so it is not just the responsibility of the task force, the government, but we speak all the time of the all-of-society approach. And so we expect every individual to play their part. We've said that this is one time in history where the singular action of one person can have far-reaching consequences for others. And so if, for example, you are placed in quarantine, you should not be trying to break quarantine because you're placed there because you might have the virus. And so if you have a friend who is helping to get you out of quarantine, that person is just as deleterious to the entire nation as the one who is coming out of quarantine. So let's make sure that we understand that we are all in this together and we do our part to contain the virus.
And this last question has to do with the CARICOM bubble and travel within the bubble. The person wants to know if there will be travel from the British Virgin Islands, being that the British Virgin Islands is an associate member of CARICOM, and the second one from the Dominican Republic. So the Dominican Republic is an associate member, is an observer, has observer status to CARICOM.
All right, so good afternoon, everyone. Very good question. And so for now, the Caribbean bubble only includes 8 territories, okay? So it's Anguilla, Antigua, Barbuda, Grenada, Dominica, St. Vincent and the Grenadines, St. Lucia, Barbados and Barbados. All right, so those are it's really 8. Dominica, right, those are the 8 Caribbean member states who are presently included in the bubble. But please note the criteria for inclusion in this bubble. So these countries or states would have had less than 20 new reported COVID-19 cases per 100,000 within the past 14 days. And so that inclusion criterion would exclude a number of other Caribbean islands or territories who may be part of CARICOM. And for example, the Dominican Republic, the number of cases is, they're seeing a continued surge in cases. And so just the number of reported cases alone in the Dominican Republic excludes them from being, included in this. And by extension, the British Virgin Islands is not included at this point in time. Thank you.
Thank you very much, Dr. Laws. We have a saying, we don't want to burst the bubble. We want to keep it bubbling. That brings us to the end of our weekly COVID-19 briefing for today. There are no more questions. I want to thank Superintendent Cromwell Henry, Divisional Commander for District A, for his presentation, Dr. Cameron Wilkinson for filling in today for Dr. Hazel Laws, our Chief Medical Officer, and I want to thank Dr. Laws as well for joining us today for this briefing. Mr. Abdia Samuel, Chair of the COVID-19 National Task Force and the National Disaster Coordinator. ZIZ, of course, who is always here without fail, and all the media in the Federation for partnering with us in terms of providing information in the management of the pandemic. And of course, Mrs. Christmas Jacobs for her support always with providing sign language for special population among us, and Vesta Southwell for her support in terms of the whole communication network here at the NEOC. Thank you very much, and tomorrow, and sorry, not tomorrow, we are not back to daily briefings. Let's hope we don't go back to those. And next week, we will be back with another NEOC COVID-19 briefing. Until then, take care. I am Les Roy Williams.
Is on.